Hey, welcome to the Healthy AF podcast. We all know that health is complex and multifaceted. Amy Chang and Fran Paradine are here to break it down, talk it up, and learn from a whole slew of really amazing guests. Fran and Amy are both health coaches, and just like health, their practices and viewpoints are individualized. You'll hear different takes on the same information as they discuss all things health, and you'll learn with them as they talk with guests who explore all different areas of health. Every episode will be fun, informative, and entertaining. If you like what you hear, please follow us and subscribe so you never miss an episode. Hey everyone, welcome to the Healthy AF podcast. Amy and I are joined today by an awesome woman, physical therapist named Dr. Leanne Reid. She owns Stillwater Physical Therapy and Wellness in Catawba, North Carolina. Leanne has over 20 years of experience working in the physical therapy world, specializes in complex spine and sacroiliac. How do I say that, Leanne?
Sacroiliac.
Sacroiliac joint dysfunctions and chronic and recurrent pain conditions. Leanne has all sorts of degrees and certifications, and she is a doctor of physical therapy. Is that correct?
Mm-hmm. Correct.
Yeah. She has completed 525 hours of massage treatment certification, received a manual therapy certification, and is a certified kinetic continual movement therapist. Is that right?
Kinetic control movement therapist.
Oh, I can't read my own writing. All right. Kinetic control movement therapist. So all of these are like really cool concepts, and I cannot wait to understand them more and understand what makes you so amazing for the patients that you see. So welcome.
Thank you for having me.
Absolutely. Do you want to just start by telling us how you got interested in physical therapy and kind of what your story is?
Yeah. So I first got interested as a patient myself. I was in and out of physical therapy in high school, just being an athlete and things, had knee surgery. And I can't say there was one specific day or anything, but it was just when I kind of came down and started to think about what I wanted to do when I grew up, just seemed something that was a natural fit. So just day one, in college, freshman year, went right into a physical therapy program and haven't looked back, and I love it. So, I feel fortunate there. But, my road was not kind of the typical when I graduated school. I went to school in Boston, where I'm from, followed somebody out to Colorado. So my first job out there was working for a physical therapist that, again, had a different vision. He did massage, and he had just opened up a small private clinic, one-on-one, kind of was doing some wellness and other things with it. So that was my first real job, and kind of he ended up being my mentor, and just got to see that physical therapy could be so much more than just kind of the more corporate and exercise and stretching that a lot of people just think physical therapy is. So, and I just took to it. I love the hands-on and so forth. So, so that's kind of how I kind of got started in a different direction, and just feel very fortunate. I never really had to work in the busy clinics that you see, 2 people every 15 minutes and stuff like that. So it was, like I said, so I really got to explore and really practice, physical therapy and do a lot of hands-on. And I love education. I always say I'm a nerd. So just always, taking a lot of continuing education too, and expanding things there. So that's kind of where, so when I moved from Colorado to Illinois, I always knew, I'd eventually open up my own place, and which I did shortly after. And so just kind of expanded off of that. And now here in North Carolina, in Catawba, have, kind of downsized just because I don't want to be quite as busy and all doing all the administrative things, but still, kind of want to practice and promote, what I think physical therapy should be.
So you now have a practice in Catawba. Mm-hmm. And how long has that been open?
January will be 2 years.
All right. Well, welcome to North Carolina.
Thank you.
We're happy to have you nearby. And so it does sound like from the get-go, you have really seen physical therapy as part of a holistic treatment protocol.
Yes.
So can you expand on that a little bit? Kind of how you see physical therapy being a part of or leading in the whole treatment scheme? What other pieces need to be in place?
Yeah, so I mean, physical therapy does encompass a lot of different things, but just in general, I feel, and doctors have kind of become the same way. Everyone specializes, and you come in for, say, a knee issue, and they just look at your knee. So to start off is really looking at the whole person physically, but also there's other body systems that are in play. So if they have other chronic conditions, usually there's an inflammatory component to that. And can they be doing other things to help manage that, whether it's diet or other lifestyle changes? And so, because if they can't get that under control, no matter how much I treat their knee, they still might have some pain. So it's, really kind of getting, sometimes it's stress or other family, things going on at home that could be factoring in. I might not be able to help them with whatever other things could be affecting their physical health. Sometimes emotional things are presenting themselves physically, and people don't always realize that. And so I do, I can not necessarily help talk them through that, but, at least help them identify that and say, maybe you do need to go see someone like you guys, kind of right. Work on, or, help point them in and really take it. A lot of people with chronic conditions, it's not just musculoskeletal. There's going to be other comorbidities, other body systems and things that, and you really want to kind of attack it from all angles to get the best results. And also just from the musculoskeletal standpoint, also looking at the whole big picture and how, say, the ankle or the foot is affecting what the back's doing, or vice versa.
Right.
So, Leanne, can you paint us a clinical picture for like a case study? Because I'm totally down. I am picking up what you are laying down. Like, I've had enough chronic issues, and right now with my torn Achilles on the left, my right hip from doing all the work is
perfect example. Yep.
Totally get that. But I wanted, if anybody isn't quite grasping what we're talking about, what does a client, your typical client who comes to you that you treat, and what kind of benefit do they get? Will you walk me through that?
Yeah. So, I mean, my, ideal client, let's say, is, let me use somebody actually just evaluated this morning. I'd say she's probably a good example. She's middle-aged, 40s, kind of, has a dance background, has been in and out of physical therapy, had a back issue, has this recurring neck issue, neck shoulder issue. That's what she's coming to see me for. Has had some decent results with physical therapy in the past, but just has this recurring, she's trying to do all these things on her own, but just no one's really kind of helping her figure out really what's driving it, what's going on. Doctor just wants to do injections. She doesn't want to do injections. And, she just doesn't want to hurt every day. She just kept saying. And so, it's nothing, she can live with it, but it's getting in her way. Now, she doesn't have a lot of other, disease. She's otherwise healthy, which is good. A lot of other patients I have might also have, say, maybe an autoimmune or some other, that can complicate things, but she's otherwise healthy, which is great. But she's really motivated, wants to figure out why and what she can do so that she can keep functioning and hike and exercise. Every time she tries to exercise, she just hurts more. So looking at it and how, she thought maybe it was her shoulder or her neck or, what. So just looking at and really evaluating all that. Turns out she's a little hypermobile. She's got issues it's been going on for a while. So she's got some issues on her right, even though her pain's on her left, but some stuff going on her upper neck too, which is not where she hurts. But it's just, trying to get all those pieces, posture, some issues, definitely some strength, mobility, but trying to find out where all those impairments are and putting the puzzle together and ideally trying to figure out which is the driving factor. So we can start there. People have, the neck and the shoulder are very closely connected, but, sometimes it's more primarily a neck issue that could be affecting the shoulder, or sometimes it's more primarily a shoulder issue affecting the neck. And so you want to just try to prioritize so you can get, the best treatment plan and just be as effective as possible. I'm not sure if that completely answered your question yet or not.
Gave me a great picture of who that is. You started out by describing Amy Chang exactly. Middle-aged, dance background, hypermobile, got some issues with the neck and shoulder, has been to other care providers and been told a cortisone shot, and maybe that's not the way she wants to go. Maybe she's been to another couple different modalities or places and hasn't gotten the kind of long-term results and healing. And sometimes when you address the shoulder and it's really the neck causing the shoulder, then the shoulder doesn't get better. And it's perplexing and it's frustrating, and you can live with it. I mean, you're not about to go, lose it, but it's not a thriving life. And
Correct.
She comes to you and you help her peel apart the onion layers of which came first, the neck or the shoulder, and how do we need to treat that? And oh, by the way, with hypermobility comes some need for strength.
And that was one big
in place.
Yes, and that was a big discussion, and it's not just with hypermobility, but it's a big one. People think they need to stretch. They feel tight. You need to stretch, and it feels good temporarily when you stretch, but stretching's not the answer. Tightness is a sensation, a perceived feeling. Doesn't mean things are actually short or restricted. So often you do need to strengthen, or something is tight or feels tight because it's compensating for something else. And so you, again, trying to get to the why and addressing that. And often by strengthening or retraining muscles, you'll feel less tight. But people have a hard time grasping that idea sometimes.
Yeah, for sure. And I know that some of my people, when I work with athletes in the CrossFit gym, if a low back is tight and you watch them from across the gym squatting, you can see that their abdominal muscles are doing nothing. And that's why their low back is tight, because it doesn't have that opposing muscle group firing.
Yeah, it's doing all the work.
Yeah, it's working its little fanny bottom off. So when you have a client like that, I know you have some super big tools in your toolbox, and I know your toolbox is fairly large because I just listened to Fran introduce you with like the hours and hours of clinical practice and all the years you've had caring for people. And so I'm wondering, what are some of the things that you might do for that client, and what's that look like? What's that path look like?
Yeah, so it's really personalized by the client, and that's why I like having a lot of tools in my toolbox, because there's not one thing that works for everybody. If there was, that's all what we'd be doing. So some people are more reactive and they need more indirect and gentle kind of techniques. So we might do a lot of education and modification, behavior modification, activity modifications, kind of getting things under control, maybe more modalities, whether it's laser, more gentle hands-on things until we can get their system calmed down. Other people, it might be more, it's super chronic, but it's not acute or irritated or inflamed. And we can be really super aggressive, get in there and crank on them, do super aggressive mobilizations, deep tissue work, fascial, I have soft tissue tools, cupping, things like that. So
Okay,
it really...
like dumb that down? When you say mobilizations, do you mean you take their arm and move it?
That could be one example. Yeah. So mobilizations is anything with movement. So we can do soft tissue mobilization. So, I mean, massage, deep tissue
Okay.
massage, myofascial release. There's a lot of these tools now with like cupping and scraping or grastining or, terms people usually are familiar with these days. Those would be all considered soft tissue mobilization. Joint mobilization would be more moving the joints around. So a chiropractor is doing a manipulation. So a mobilization is more like stretching of the joints, but getting in there and manually, manipulating the joints, but not necessarily crack. The manipulation would be the high velocity, low amplitude. And I am actually trained in some manipulation. That's not my primary thing. I do a lot of muscle energy techniques, which are utilize contract, relax, and reflexive inhibition to get into and work those restrictions. So again, there's just different ways of going about it. And so it's really based on, personal preference for some people, and just how they're presenting, and sometimes just instinct, what I feel like is going to work best for them. But sometimes when one technique isn't working, then we've got more than one way to get our end result.
Yeah. Right. So Leanne, I know that a lot of you have a ton of tools and a lot of stuff takes place in your office. So what does that look like for the clients when they're outside of your office? Because I know that, with any type of work we're doing kind of in isolation in an office can often be undone pretty quickly when we send people back out into the systems that got them there to begin with. So I know you're educating them in the office. What, between sessions with you, between appointments with you, what are you giving them, or what are their homework?
Yeah. So, usually they get something. I don't like to throw a lot at them at first because I want to know what's kind of working and what's not working. So sometimes it might take a little time to build up a full program. A lot of the education, make sure they're, at least aware of the things that are negatively impacting them. But I really like, Greg Cook is with the functional movement systems. And he's got the 3 R's, and this just really kind of just made a lot of sense to me and how I kind of look at things. If now I'm making sure I remember this correctly, it's reset. Reset, reload, reset, reinforce, reload. I think is the correct order. So the reset would be what we do in the office. We're working on the mobilization, or whether it's joints, soft tissue. But then you need to reinforce that. So that's where a lot of the home programs come in. So just again, my patient this morning, she's got mobility in a couple of areas. So I did just a little bit while she was there. And then I got her on the foam roller and showed her a routine on there for to work on those specific issues. Because then she's got to keep those areas that I just mobilized, she's got to keep them moving. You need to relubricate those joint surfaces, get that connective tissue gliding and sliding, and, or whatever tissue it is. Because if they go back and just sit on the computer all day, well, it's not going to be very effective. So you got to reinforce it somehow. And so even if people are doing a lot of people will roll on the foam rollers at home, or use the balls or all these other soft tissue tools out there, but then they don't do anything afterwards. Same idea. Even if you're doing self mobilization, you want to move afterwards. You want to at least do some stretching, do some range of motion. You got to move and reinforce whatever, you were just trying to release. And then the reloading is kind of that final integrating it into function, strengthening and, and trying to often if it's an injured tissue, you have to gradually reload it to get it used to being able to take whatever load it's supposed to or needs to take. But that can look differently in different people. So sometimes I am giving them more passive things to start with, like whether it's just laying on the foam roller, some self, like with a ball, or things if we just need to deal with pain. If it's more mobility, they definitely need exercises, stretches or things to keep reinforcing and moving whatever it is that we're trying to move. Sometimes we use taping techniques. So if it's more postural, or again, someone doesn't have the awareness yet to be able to control or whatever it is, we can utilize some tape to help to support or give them some feedback of like, oh, you're doing this again. You need to, change that. It takes thousands of repetitions to create or change habits, as I'm sure you guys know.
Yes. Yes. All right. So, Amy, did you want to jump in with something?
Yeah, I actually did. What I'd like to know is, and just to create an awareness of, I've been through physical therapy forever in all kinds of ways. And I've also worked with athletes who do physical therapy, or like they have an injury or a surgery and then they do physical therapy.
Mm-hmm.
And it's a real hot button for me. I'd love to hear your take on it. That they're like, yeah, I'm going to do 6 weeks of physical therapy. And I'm thinking in my head, okay, you've been at CrossFit for, 3 years and you're pretty athletic and you're enjoying your athleticism. You're not going to do physical therapy for 6 weeks, FYI, and then be back in the gym at where you were performing. You're going to be at maybe activities of daily living where you're walking normally, and you might be picking up the laundry basket normally, but we're not talking about the load of, now I'm jumping on a box and I'm swinging on a bar. And, and so I wondered if you could share your experience with like some of the healing.
Yeah. And a lot of it is managing those expectations, which is hard because the doctors are, oh yeah, in 6 weeks, you'll be fine after surgery. Well, that, like you said, some people, what their expectations are at that 6 weeks are just not realistic. Because there are certain things you can do to maybe maximize or possibly speed up the healing process. But the fact is that there is just time, and certain just cells and tissue, and different tissue takes different time to heal. And then once it's healed, it doesn't mean it's ready to take all that load right away. So just like you had to build that up to begin with, and it's not just muscles. And this is something, and people understand that, oh, I kind of work my muscles. They get stronger as I kind of break them down and they rebuild. Bones, the same thing. We know, or most people realize, osteoporosis. If I do weight bearing, weightlifting, kind of it helps to stimulate bone growth or increasing my bone density. There's other factors too, but that's one part of it. But that goes for all our tissue, our ligaments, our tendons. So, for example, you have a rotator cuff surgery. And it's not just recovering from the surgery itself. A lot of people, they had that issue going on for months, possibly years going into surgery. And, they couldn't do things normally. Or, maybe they were non-weight bearing for a month. If it's a knee issue, they couldn't get in for surgery right away. Or we saw this a lot with COVID. Unfortunately, people had injuries, but couldn't get the treatment. And then it was a year later, they finally had surgery. So it's not just the recovery from the surgery itself. You have to factor in that time, the whole year prior, or month, or whatever it was, of things not working properly, of not having good range of motion, tissue not being loaded appropriately.
And then your sweet little body in other ways compensating.
Right? Well, and then you have all those other issues too.
That right hip, like, Amy, you better be careful.
Yep.
That right hip to do.
Yep.
Because what you don't want to do is come out of your boot finally on your left foot and then have to go into physical therapy for your right hip.
Yes. And people just think I can jump right back into doing everything. And then they end up with other issues. So it's hard. And like I said, a lot of it, again, education, trying to manage those expectations and, and it's the education. Whether people want to listen to it and follow, still not always the case, but you just do your best and, and trying to just educate that this is just, tissue healing, most soft tissue, 6 to 8 weeks, for, full tissue healing, but that doesn't mean it's strong yet. So it's like, okay, like you said, you're back to your normal daily activities. You can do normal, average things, lifting body weight, light weights. Doesn't mean, you can do plyometrics and jumping and, lifting, what your 1 rep max yet, or, you have to, just like you would be training for anything, you have to retrain and build that back up. And it's a process. And a lot of overuse injuries is that people overtrain, and you don't have that recovery time. If you're going to be working things, that is how it gets stronger, but you also need that recovery time for it to rebuild, so that you just don't keep breaking it down and end up with these tendinitises, tendinopathies, and all those sorts of things.
So, yeah. Leanne, I know from when we spoke before, and this is also on your website, that you really enjoy the kind of complex cases. Like that's what you kind of can dig your teeth into and really feel like you are making a difference for these people. And I think often you get the referrals from people who feel like they've been to everybody else and nothing's worked. Here they show up at your office, and you are supposed to kind of be the one who fixes them when everyone else can't. Can you talk about why that fuels you? What it is about these cases and these people that really kind of get you going?
I think I like the challenge of it, and just it's stimulating. But then when you can help them, it's just great. Like you said, they've been to this many doctors and this PT and this chiropractor and this massage therapist, and maybe they get a little help here or there, but just to get answers for these people sometimes and help to explain. Often they can get to a point that's just, they're being told it's all in their head, suck it up, or, things like that. And pain gets very complex, and it could be because of some changes in the brain, because chronic pain can cause, changes. But that can still be managed, and doesn't mean that it's got to stay like that forever. But, they think that there's no hope, or it's just, they get just prescribed, this or that. Right. So it's great to be able to empower these people and see that there is some options. Again, I don't say I can fix them per se, right. But I always feel like, there's always room for improvement, and we can help manage and improve their quality of life. And it's great, it's just feels good, to be able to help and to see these people come in, and then, they're in tears because now they've been able to, do whatever that they haven't been able to do for a while, or, things like that. And it's not always but it's a big deal to them. Right. They may never be able to be in the CrossFit gym, but it's sometimes just, simple things like they could go grocery shopping, but for a half hour and not be done for the rest of the day.
Mm-hmm. Mm-hmm.
For me, honestly, there was a good bit of time that I struggled with my back in particular. And once I entered sort of the healing process for my back, not the Band-Aiding, but the real healing for my back, the thing that I almost brought me to tears every day with gratitude was being able to tie my shoes first thing in the morning. Yep. Because I was just too tight. There was no getting down there. I'd go into the gym to teach my classes and have one of my athletes tie my shoes for me because I just couldn't do it.
Yeah.
And so just to be able to do that consistently would almost bring me to tears. So yeah, having people around me in my healthcare journey that listened. And I can hear you listen, right?
Yes. And then that's a big thing. And unfortunately, a lot of just the way practices are, they don't have the time. I mean, it's not that they don't want to listen. I feel like they're overworked. The environment doesn't promote it. It's just very difficult. So staying private and being independent it does allow me to, and I think that is half of it, is these people, sometimes that first visit, we barely get any evaluation done. It's just talking and listening and trying to get the whole story, because they have a lot of history and have been to a lot of people. So,
Yeah. And I think you also provide them with some hope, right?
yeah,
I mean, it sounds like you're
hopefully
very,
realistic hope, but yes.
right. No, you're very realistic. You're very, like, this is where you are.
Hmm.
You're not going to be running a marathon next month, but
Yeah.
I do think we can probably help with this. And having being heard and then instilling that just kind of bit of hope, I think is probably very powerful.
I think so.
And then they feel somewhat empowered,
Yeah.
like, okay, somebody heard me, somebody believes me.
Yes.
And
And there are things that then they can do, too, for themselves.
yes, I think that's huge.
Hmm.
I totally got a sense of that too, Fran, by the way, when I was listening to her. It's that people have that one little tether. It may be the last string that they're going to pull. Like, I know I've been to 15 other people. I know that I've heard I've got to have a cortisone shot, or I've got to have surgery, or that I'm never going to be able to do this again, or that I need to just stop playing tennis for the rest of my life, or that I need, whatever. But I'm going to just try this one. There's this lady named Leanne, and I'm going to just try, and then to just have the partnership of listening, of huge, massive toolbox, of we're going to try this tool. If it doesn't work, we're going to try this tool. I'm right here with you. And this is
Hmm.
realistically what you can expect on your journey to healing.
Hmm.
Like, that's the juice right there.
Yeah. And I mean, and honestly, sometimes I see them and I do say, like, you know what, I'm sorry, but I think you do need whatever surgery it is that they're recommending. It's just, that does happen, but at least then they, again, feel like they've been heard and really kind of evaluated and assessed, with everything, especially if they have already, some people have kind of gone through and done all the things that would have done anyway.
Right.
And they're just some things that sometimes that is just the last step. But
Well, then I would imagine for those people, they also, then they can go into that surgery with some sort of plan, right? I
yes.
mean, pre-surgery, I think there are things you can do
Oh,
to,
for sure. And I always say that even if we can't keep you from not going in for surgery, at least you're going to go into surgery in better shape,
yes,
in improve in that's going to improve your outcomes of surgery, or you have some expectations and things. It kind of gives you a jump start.
right.
And I
So
think
going
that's,
into anything like that with a plan, right,
hmm,
feels so much better. I mean, I think that's
yeah,
what a lot of what we do as health coaches is like
yeah,
help
yeah.
people anticipate what's coming up. Some of it cannot be avoided, but if you handle it the best way, if you handle it with your end goals in mind and with these plans and plan A, B, C, D in
Hmm.
place, then you are just going to come out of it in a much better place.
Yes, yeah, and because the doctors do not do a good job of preparing people for
No.
with those plans.
No, or with aftercare. I mean, I've certainly had my share of surgeries, and I did not get great aftercare.
Yeah,
Um,
yeah. I mean, they do kind of expect the physical therapist, kind of, that's their job often. But I mean, there's some surgeries, that, I mean, or I shouldn't say some, quite a few surgeries, it's people are not going to physical therapy afterwards. So then there's really, like you said, very little to any aftercare.
right.
I was talking to one of our other podcast guests, Kyle, and I think this sums it up. People need advocates.
Mm.
And, from a nursing perspective, the first thing in my nursing code of ethics pamphlet back in 1995 was your job is to be an advocate for that client, period.
Mm-hmm.
That's your job. And the rest of it can come under number 2, 3, 4, 5, 6. We can talk about autonomy and beneficence and ethics and all that stuff. But your number one job is to advocate for that client.
Mm-hmm.
And I think that our healthcare system is complicated. Our bodies are miraculously, beautifully complicated.
Yes.
And if you don't have a person, either a healthcare provider who will see your whole picture, or a spouse or friend or partner who can go with you just to be another set of ears.
Oh yeah.
And better if they have some healthcare experience, even if it's not as a practitioner, but in the system and how it works and how your insurance works and how, all of those pieces fit together to help you stop, look at the data, make your choice, have a plan. Then when your plan socks you in the nose and smacks you down, make another plan. Just that advocacy is huge.
Yeah, for sure.
Yeah, and I think that kind of going back, that to be an advocate, you need to know the client, you need to hear the client, you need to know what the issues are, and I think that is what differentiates you from a lot of other physical therapists out there.
Yeah, and I love developing those relationships because then in the future too, something comes up, it just, I know, and it just makes it much easier to kind of like, oh, this is, this is not normal for you. Like, whereas,
Right.
They might have to start from scratch with someone and can take a while to get to where they need to get to.
Right.
We can be like, oh no, this is, we can just get right to it and address it and everything. And so, I've had clients I've worked with for 10, 15 years, off and on. And usually, I see most of the family and stuff. And it's just great. I mean, I love developing those relationships just for many reasons.
Absolutely.
This has been great, Leanne. Thank you so much.
Oh, thank you.
I've got one last question for you. You ready?
Yes.
How am I going to word this? If you were to give our listeners one nugget, I know, right? Putting you on
The pressure is big.
I know, one nugget that they could take away for themselves in this podcast, what would that be?
Oh, I guess don't give up as far as trying to advocate for your health and finding someone that can help you, whether, it is a physician, physical therapist or what have you, is if someone can't help you, don't just give up there, keep getting other opinions, keep getting referrals, keep trying different things, because there's so much out there. And that there's probably someone out there that can help you, or at least get you, keep pointing you in the right direction. So just don't think, oh, I've already tried physical therapy, it was pointless. Well, not all physical therapy is the same, not all doctors the same, and so don't give up, and take control of your life and take, be proactive.
Yeah. So what I'm hearing underneath that is to trust yourself, right? To trust that you know your body and you know it better than any doctor you're going to visit, any therapy, so trust your own instinct. That's what your body is telling you.
Yes.
It's beautiful. It's awesome. And that's why it makes you so special. So you want to let people know how to contact you, or how they can, if they're interested in making an appointment or learning more, what's the best way to do that?
Yeah, so probably the easiest thing, and most of the information is on my website, stillwaterkataba.com. You can, that's got some more kind of background of some of the modalities and my trainings that I do. You can schedule online through there also. Certainly you can always call, contact information is also on there. I work by appointment. Everyone's initial appointment's always at least an hour, because I want time to talk and, go through. And actually this morning I had time. I ended up spending an hour and a half with my first patient, just because we got talking about different things. So that's the easiest way, since I'm just a one-man show. I don't have somebody to answer the phone and stuff. So often if you call, I'm not going to be able to pick up right away. So you can leave a message or email Leanne at stillwaterkataba.com. those are kind of the easiest ways to get a hold of me, or I'll probably be able to respond quicker through those avenues.
All right.
Awesome. And we'll put those in the show notes as well,
Yeah.
so that people
Thank you.
can just click away. So I just want to wrap up here by saying to everyone listening, you've just heard it here. Don't give up. There's hope. If you're listening to you and your body is telling you that there's hope and there's something that needs to be done, don't give up. There's help for you. And we certainly believe in that. If you've loved what you've heard today, please like and subscribe to the podcast. Share it with a friend because you know somebody else needs these nuggets. And thanks everybody for coming out, and special thanks to you, Leanne. And thanks for the care provider you are in our healthcare system.
Thanks for having me.
100%.